My name is Rian. I'm a clinical engineer of Center for Biomedical Engineering, master student and volunteer in NGO Brazilian Health Expeditions. The title of this work is Logistics of Medical Devices for Indigenous Healthcare Attending in Remote Sites at Brazilian Amazon Rainforest. The co-authors are Fernando Andrade and Rodrigo Bernardes, and our advisor is Professor Said Jorge Khalil, PhD. The objective of this work is to describe transportation process, installation, operation, and maintenance, used to ensure safety use of medical device in a field hospital in the Amazon forest and to present solutions to the proposed adverse conditions throughout the course of several expeditions. There are in Brazil about 430,000 indigenous living in the Amazon forest, most of them in isolated regions. The basic health care for this population is provided where they live by health teams. Complicated cases require displacement of this population to urban centers by fluvial transport. Therefore, this process increases social and health costs. In order to reduce such impact, the NGOs assembles a field hospital to provide specialized health care for this population. The field hospital has a surgical center, sterilized central ophthalmology, pediatrics, odontology, gynecology, and general clinic. Main surgeries are hernias and cataracts. Just as in hospitals, the clinical engineer is responsible for safety and efficacy of medical devices. Field hospitals require transportation of a 15-ton of load, such as tents, generators, food, medical supplies, medical devices, medicines, etc. The general distance to site is around 3,300 kilometers. We estimate that in 7 years there is a displacement of about 110,000 kilometers. In some cases, cargo transport is carried out by military cargo airplanes. There is infrastructure in some airports, such as forklifts. However, in most of them the unload is done manually. Medical devices are transported by several load models, such as air, fluvial, and roads. The lack of a proper infrastructure is compensated by the support of the Brazilian Army and the residents of the region. Despite all the planning and care of clinical engineering, adverse events may still happen. This shows that the SCE needs to act even more in the process of management, planning, and control during expeditions. This is a boat that sank on a sandbar in the river. The first step in the methodology is a task analysis, aiming to know what is the process related to medical devices. This process involves the transport, assembly, installation, maintenance, disassembly, and storage. The task analysis is divided into planning, preparation, transport, and operation. This diagram is dynamic because it can be changed with the next step, which is the spiral cycle. Each new expedition raises new challenges, demanding propositions of new solutions. For better management, a continuous and spiral work method was developed. This spiral cycle has 4 phases. 1. Identifications of problems. 2. Proposed solutions. 3. Selection and analysis of proposals. 4. Implementation and testing. The problems and solutions were identified by analyzing 21 expeditions within 7 years. To select and analyze the proposed solutions, we consider the economical limitation and lack of voluntary manual work. Problems may be related to technological specificities, Limitations of technology not designed to the environment where they are going to be used. For example, the material used or design, like weight or size. Environmental factors, the natural characteristics of environment with influence both in use or transportation. For example, temperature, humidity, condensation. Operational, use of the device includes transportation and assembly. We will cite just a few examples of identified problems. Technological, break of connectors and equipment without better backup. Environmental factors, fungi in lens, oxidation of parts and equipment not working in ambient temperature. Operational errors, lack of contingency accessories, and damages during transportation. To conclude, Spiromet has improved the work process for the Amazon Challenge. CA is responsible for new roles such as storage and transportation. The planning is very important. CA must have a plan B and needs flexibility to solve problems during operation. The methodology shows how important CA support is to provide safety and efficacy for medical devices in diverse environments. I would like to thank the University of Campinas through the Electrical Engineering Faculty, Center for Biomedical Engineering, and the NGO Brazilian Health Expeditions for the opportunity of presenting this work. Thank you.